My name is Jared Francino, and this is my informative speech with the title Neonatal Nursing. So during pregnancy, there were no red flags. Your doctor said you and your baby were going to be healthy in the end. But after hours of labor, your baby, infant, newborn, becomes distressed. So what happens? The team of nurses come in and take your baby away and tell you everything will be okay, and you're left there wondering how and why this happened or what's going to happen in the future. Well, that's when the neonatal nurses come into play. So what exactly is a neonatal nurse? Well, a neonatal nurse is a nurse who takes care of babies or newborns from birth till 28 days. There are levels of different kinds of neonatal hospital settings. There's level 1, 2, and 3. Level 1 takes care of the healthy newborns that are usually transferred right after delivery to the nursery for stabilization. Level 2 will take the baby after birth that is either premature or has a mild illness, and they'll take them to either a mild NICU setting or to the nursery for further evaluation and stabilization. Level 3 NICUs, though, or Neonatal Intensive Care Unit, cares for the sickest of newborns. Level 3 NICUs have respiratory therapists on deck, neonatologists on deck, and also, of course, the neonatal nurses. They care for the birth of a newborn until they are discharged, and some infants require more care than others. This results in the infant coming back to the hospital for monthly checkups, usually. So when a woman does give birth and the problem does arise, like prematurity or birth defect or infection, what happens? Well, there's a lot of equipment to be used. One piece of equipment that's very important is a nasal cannula. A nasal cannula is you all have probably seen it before, wraps around your neck and hooks up to a tank of oxygen or a supply of oxygen nearby and goes through your nose. Babies need this after birth because of the increase or of the lack of surfactant. So when you have a baby and they come out of the womb, they're so used to taking the air from their mother or the oxygen from their mother. But when they come out of the womb, they don't have the slickness inside the lungs to go back and forth. Therefore, this results in the baby crying, and they have to give them nasal cannula for the oxygen. That's just one of the many problems that arises that neonatal nurses help resolve. But why are they actually important, and why can't the doctor do it? Well, neonatal nurses are so crucial to the process because it's the start of life. Depending on the level of care of the infant, the infant could be 100% in good shape, or the infant could take a turn for the worse. This is why nurses have to be on their A game 100% of the time. And also with the baby boomers retiring, and the hospitals are facing a huge deficit in the number of neonatal nurses. However, with all the demand for neonatal nurses, a resurgence of Bachelor's of Science nursing graduates is increasing by the year across the nation. So in conclusion, being a neonatal nurse comes with a lot of responsibilities, but the neonatal job also comes with a lot of rewards. All in all, neonatal nursing is crucial to life. Neonatal critical care is provided around the clock and on weekdays and holidays. These nurses can be expected to work 12-hour shifts 3 times a week, and more often than not, they pick up overtime. Whether or not an infant has a problem coming out of the womb, you can expect the nurse ready to serve.